This question is asking us which of the following abbreviations is included in the Joint Commission's TJC do not use list. Now, it can be helpful to review this list and understand the reasoning behind why certain abbreviations are not used in order to approach these questions. The do not use list is referring to certain acronyms or abbreviations that are not widely accepted and could be easily misinterpreted, and therefore the Joint Commission, or the governing body of the medical practice, are advising everybody to avoid these terms and not to use it to avoid any medical errors. So let's look at the choices and determine the correct choice. So option A is BMI, or your body mass index. And this is an acronym that is commonly used. You might see it on growth charts if you work in pediatrics, or you might see it just in the basic exam of a patient. They might include their height, their weight, and their BMI, their body mass index. And that is something that providers and medical professionals use. So we can eliminate option A. Option B is the commonly accepted abbreviation for heart rate. You might see in their vital signs listed, it might say heart rate 80 BPM, beats per minute, for example. So heart rate is a commonly accepted abbreviation. So we could eliminate that. Because as a reminder, the question is asking which ones we should not be using. So both of these choices so far are ones we can use, and that's why we're eliminating them. C is saying BP, and that is a common abbreviation for blood pressure. So you might see when you look in their vitals chart, BP 100/60, for example. So that is an abbreviation we can use, so therefore we will eliminate it. Now we have QOD, and QOD is in fact on the list of a do not use term. QOD, which you might see sometimes written as lowercase QOD, this could be easily misconstrued as other words. The Q and the O and the D, they all look like other letters, potentially. It could potentially be confusing or mixed up with another term, QD. QOD means every other day, and QD means every day. And even if you see here how I drew the D, it looks a little bit like an O. This could be misinterpreted. Patients could easily make very detrimental mistakes if they take a medicine every day that should really be every other day. And just to avoid any potential errors, it's best practice to just spell out every other day instead of using the term QOD. So since we cannot use this term, we are going to choose this because the question is asking us which is included in a do not use list. So the correct choice is what you should not be using, which is choice D, QOD.